Welcome to the annual HOPE Conference, and thank you very much to the Northwest Parkinson's Foundation for the invitation to be with you today. My name is Ray Dorsey. I'm a neurologist at the University of Rochester. Today, I'm going to discuss with you a hopeful scenario that we can end Parkinson's disease. And I'm going to submit to you the way that we can end Parkinson's disease is not by curing it, but by preventing it. I'm going to argue to you today that Parkinson's disease is largely a man-made disease, and as such is a preventable one. Hopefully you're seeing my screen here. I'm going to talk to you about the age of degenerative man-made diseases in which we live. Talk to you a little bit about the rise of Parkinson's disease, how it went from a very rare condition 200 years ago to the world's fastest growing disease today, and talk about how we can end Parkinson's disease. A very smart French-American scientist in 1959, René Dubos, said that every civilization has its own kind of pestilence and can control it only by reforming itself. Said another way, every society creates its own diseases. An epidemiologist, Dr. Abdul Omran, in 1971 put together a model for looking at population growth. And he argued that early humans died of pestilence and famine. Quite simply, there wasn't enough food. And then with the agrarian revolution about 10,000 years ago, that enabled the storage of food, the formation of cities, and large population centers. And during that period of time, early humans died from receding pandemics. Think about the bubonic plague in the 1300s, the smallpox deaths from the 1500s all the way through the 20th century, and the influenza pandemic in 1918. And they said we've now transitioned to the age of degenerative and man-made diseases. Some of these might be heart disease, most types of diabetes, car accidents, and I'm going to argue to you Parkinson's disease. And then others have extended that model and said that in the future we're going to die of delayed degenerative diseases and emerging infections born out of hubris, of which COVID-19 could possibly be one. The poster child for man-made diseases is lung cancer. And 100 years ago in the early 1900s in the United States, lung cancer almost simply did not exist. There was almost no lung cancer in the United States in the early 1900s. If you look at this graph, and you look at the curve in black, which is lung cancer deaths in the United States, you can see in 1925, it's almost zero. It wasn't until the advent of cigarettes in the late 1800s in the United Kingdom and then the early 1900s in the United States that we saw a rise in lung cancer deaths. And you can see there's almost a perfect correlation between the rise in smoking and the rise in lung cancer deaths, importantly with about a 25-year lag. And one of the great public health accomplishments in the last 50 years has been a decline in smoking. And as soon as we've stopped smoking, we've seen a corresponding decline in lung cancer deaths. Early doctors in the 20th century said that they would take special notice when confronted with a case of lung cancer, thinking that it was a once-in-a-lifetime oddity. Well, what does this have to do with Parkinson's disease? Well, Parkinson's disease also was extremely rare when Dr. James Parkinson described the condition in an essay that he wrote on the shaking palsy. He described 6 individuals in London, England, who he said had developed a condition that had not been classified in the medical literature before. He was 61 years old at the time and practicing medicine for 30 years and his father was a physician. So he knew a little bit about medicine and knew a little bit about what medicine knew and did not know. And he said that this was a new condition. Later, the French neurologist Jean-Martin Charcot named the disease after him, calling it La Maladie de Parkinson, or simply Parkinson's disease. 1950s and 60s, we identified that individuals with Parkinson's disease had less dopamine in their brains, which led to the development of the most effective medication for Parkinson's disease called levodopa. 1980s, the first environmental cause for Parkinson's disease was identified in Northern California when individuals using a street form of heroin was found to be contaminated with a chemical called MPTP that bears a striking resemblance to pesticides that are used today. In 2000, the Michael J. Fox Foundation was formed. 2003, a German pathologist put forth a striking proposition that Parkinson's disease does not begin in the brain, but begins in the nose and the gut, and might highlight ways by which environmental factors entering the nose and gut could lead to Parkinson's disease. And in 2017, the Global Burden of Disease study identified Parkinson's disease as the world's fastest growing brain disease. It wasn't always that way. As I indicated, Dr. Parkinson was describing largely a new condition that had previously only been described in very rare circumstances from ancient Chinese, Egyptian, and Indian texts. In London, 1817 is the height of the Industrial Revolution, and the capital. The air was so polluted that you couldn't even see across the street. Those of you who've been watching the TV show The Crown know that the London fog has little to do with weather and everything to do with air pollution. As I indicated, Parkinson's disease is now the world's fastest growing brain disease throughout the world. And some of the earliest features of Parkinson's disease suggest that the disease may be beginning in the nose, because loss of smell is one of the earliest features of Parkinson's disease that begins years, if not decades, before the onset of the classic tremor and slowness of movement that are widely known to characterize Parkinson's disease. In addition, constipation is an early feature of Parkinson's disease, again suggesting where the disease might be beginning. And as different parts of the world have polluted their air, Parkinson's disease has largely followed suit. So Parkinson's disease first rose to prominence in Europe, where air pollution, the Industrial Revolution began, then North America, now Asia, where the rates of Parkinson's disease are the fastest growing in the world, and in Africa, Parkinson's disease is substantially less common. In addition, Parkinson's disease may begin in the gut, and synthetic pesticides were introduced shortly after World War II, where their indiscriminate use led to their use in households, wide use on farms, and led to many people, probably people watching this presentation, to be exposed to pesticides through the water that they were drinking, especially contaminated groundwater, the air that they were breathing, and potentially the foods that they were eating. One of these pesticides has been strongly linked to Parkinson's disease. It's called paraquat. It was developed in the 1960s, considered the most toxic herbicide ever created. It kills the weeds that Roundup doesn't. Over 30 countries, including China, Syria, the United Arab Emirates, have all banned this chemical, but the United States has not. In fact, just earlier this year, the EPA reauthorized the use of paraquat, even though paraquat increases the risk of Parkinson's disease by 150%. It's also toxic to the same dopamine-producing nerve cells that are lost in Parkinson's disease. Paraquat's found in Washington State. It's found in outside of where I live in Rochester, New York. Use of the chemical has tripled in the last 25 years, doubled in the last decade, and increased 20% the last year, for which data are available. We are in essence sowing the seeds of future generations of Parkinson's disease by continuing to allow the use of this pesticide. Another environmental cause for Parkinson's disease is likely a chemical called trichloroethylene. It's really quite simple. It's got 2 carbon atoms here in black, 1 hydrogen atom, and then 3 chlorine atoms in green, hence its name, trichloroethylene. Widely used as a degreasing agent. It melts away grease. Also been widely used in dry cleaning, carpet cleaners, use to decaffeinate coffee. Anyone using Senka in the 1970s was likely exposed to TCE, was used in whiteout, even used as an anesthetic until the FDA banned its use in the 1970s. It's a ubiquitous chemical. It's still being, its use is still permitted in the United States, although some countries in Western Europe have banned it. A recent article in The Guardian highlighted that TCE is found in many household cleaning products that some people may have on their shelves. TCE, for our purposes, increases the risk of Parkinson's disease by 500%. This is research from Dr. Samuel Goldman and Dr. Caroline Tanner, now both at the University of California, San Francisco. They looked at twins who were not exposed to TCE and twins who were exposed to TCE through occupation or hobbies, and found that the risk of Parkinson's disease was increased sixfold, 500% increased risk of Parkinson's disease in people who were had exposure to the chemical. And they concluded their 2012 paper saying that given that TCE is ubiquitous in the environment, ubiquitous in its use in the United States and around the world, that the potential public health implications are substantial. Importantly, they indicated that there was a lag of between 10 to 40 years between when people used or worked with TCE and developed Parkinson's disease. Just like with smoking, you don't smoke cigarettes and develop lung cancer. You don't work with TCE and develop Parkinson's disease the next day. And their note that the public health implications of this chemical are substantial, I think is indeed right. Over half of Superfund sites throughout the United States, those that are most contaminated and designated for cleanup by the EPA, are contaminated with TCE. Some of those are near where you live in Washington State and Oregon and Alaska and Idaho, and many of them are found throughout the United States, including over 20 in Silicon Valley alone. In addition to these sites, there are thousands of other sites contaminated with TCE throughout the country, including one 15 minutes from my house here in suburban Rochester, New York. These are 15 of the 21 sites contaminated with TCE in Silicon Valley. TCE was widely used to clean electronics and silicon wafers, and thus you can find 15 of these Superfund sites on a simple 7-mile stretch of the 101 freeway in Silicon Valley. TCE is important because it can contaminate the air. People can breathe it in, especially those who are working with it, or those who live in buildings, schools, workplaces, or homes near contaminated sites. It contaminates groundwater up to 30%. Up to 30% of the groundwater in the United States is contaminated with TCE, and this TCE can enter people's homes through vapor intrusion, which I'll discuss in a second. Vapor intrusion undetected. TCE can be inappropriately disposed of from dry cleaners, from military sites, from industrial sites, contaminates the soil and underlying groundwater, forms underground plumes, and can evaporate, just like many of you have had radon testing in your homes, because radon can evaporate from the soil and cause lung cancer. Well, TCE can evaporate from the soil and groundwater, can cause cancer, and can cause Parkinson's disease. These TCE contaminated sites are all over the country, and they're all over Seattle. A quick internet search led me to the former location for Rain Check Cleaners in Bothell, Washington, right near Seattle. This is a picture of the contaminated site that's currently now being run by a different cleaners. I can't forget what its name of it's called. Maybe your eyesight's better than mine, but you can see the name of the current location. This dry cleaners Rain Check operated from 1950 to 1967. In 1990, the city of Bothell acquired a parking lot on 10,005 Woodinville Drive. About 10 years later, they did soil and groundwater testing and found it to be contaminated with the dry cleaning solvent perchloroethylene, a compound closely rated TCE, just has one additional chlorine atom, and TCE at levels 10 to 20 times the standard for state cleanup. One boring site, one sample site, was located just above the bank of the Sammamish River here in Bothell, Washington. And in 2009, contaminants were found migrating south along utility and sewer lines in the corridors in Bothell Way. They're found all over Washington state. And this is a picture of the Fairchild Nike Battery 87, an anti-aircraft missile site for the Air Force in Deep Creek, Washington, in eastern Washington state. In 2004, results from testing of a well there found high levels of TCE. And then 20 nearby homes near this military site were tested, and 3 had elevated levels of TCE that required treatment and remediation. In 2006, 19 additional wells were found to have other chemicals, those used in rocket fuel, present, and at least another one with TCE. These sites are continued to found all the time. I just did a quick Google search, and this is from the Seattle Times from April 12th, 2021, reporting that Boeing plans to spend millions cleaning up pollution near its Everett plant. I'll just read the headlines. Boeing will spend millions of dollars in decades cleaning up pollutants that have seeped into the soil and groundwater beneath one of their plants in Washington state. TCE is one of the many pollutants that have been found in groundwater near Boeing's Everett plant. TCE is a solvent that's used to degrease metal parts and is a carcinogen to humans. The National Cancer Institute considers TCE a cancer-causing substance. Last year, the solvent was detected in groundwater near the plant at a concentration more than 1,000 times the state limit. This article doesn't discuss whether people were drinking that contaminated water, but that has happened at numerous locations throughout the country. This is all the more maddening because the TCE's dangers have been known since at least 1932. So this simple chemical was created in the 1920s, and this is an article from Dr. Terry McCord, a physician from my hometown of Cincinnati, Ohio, who worked for Chrysler Corporation. And he wrote this article, letter to the editor of JAMA, the Journal of American Medical Association, one of the leading medical journals in the world. He said that promotional activities seeking the extension of industrial uses of TCE frequently fail to disclose the toxic nature of this chemical and the practical dangers that may attend its use. He gave TCE, he had rabbits inhale TCE and they died. He put the TCE on the skin of rabbits and they died. He concludes it by saying that any manufacturer contemplating the use of trichloroethylene may find in it many desirable qualities. 2, in the absence of closed systems of operation, he may find in this solvent the source of disaster for exposed workmen. What he could have extended is not just for exposed workmen, but for those who live in the communities near where TCE is used. So that's all the bad news. So what can we do to end Parkinson's disease? In our book, Ending Parkinson's Disease, we outline a pact, P-A-C-T, to prevent Parkinson's disease by banning pesticides like paraquat and the chemical called trichloroethylene, advocate for additional resources to treat Parkinson's disease. The same time that the number of Americans with Parkinson's disease has increased by 35%, funding from the National Institutes of Health adjusted for inflation has actually decreased. Parkinson's up 35%, NIH funding flat or declined when adjusted for inflation. We need to care for everyone affected. One of the silver linings of this COVID-19 pandemic has been in wider use of telemedicine, which allows care to be brought to patients instead of patients brought to care. We need to ensure that telemedicine remains a care option for millions of Americans. And we need better treatments for Parkinson's disease. The most effective medical treatment for Parkinson's disease was developed in the 1960s. The most effective surgical treatment was developed in the 1980s. We have had no major therapeutic breakthroughs for Parkinson's disease this century. The fundamental way that we treat Parkinson's disease hasn't changed in 50 years. There are very few conditions for which we can say that is the case. We need more effective treatments for the 1.2 million Americans who have Parkinson's disease today. We've done this before. We've prevented and to a large extent ended diseases. We did that with the March of Dimes in the 1930s and 40s, leading to the development of a vaccine for polio that has nearly eradicated polio from the entire world. In the 1980s, we confronted another unknown and uniformly rapidly fatal virus. And in that setting, a group of activists in San Francisco and in New York City adopted a model of silence equals death. And for people with HIV, silence did equal death in the 1980s and early 90s. And but through their activism, through them barricading themselves in the FDA, at pharmaceutical companies, through their quilt that covered the National Mall. They changed the dialogue, and the absence of initial federal response in the early 80s have led HIV to receive $3 billion a year of NIH funding. By contrast, Parkinson's affects roughly the same number of Americans as HIV and receives less than 1/10 that amount. And that funding for HIV has led to highly effective treatments for HIV that have prevented many of us, including probably some of us listening, or at least some of our family members, from ever developing HIV, and have now led to HIV having a near normal life expectancy when treated appropriately. By contrast, for Parkinson's disease, there's been far too much silence, and that silence is equals suffering, needless and preventable suffering. Parkinson's disease is to a large extent preventable. I've given you some of the evidence for that fact, but we continue to sow the seeds of future generations of Parkinson's disease. Until we change our individual and societal behaviors, we will continue to allow Parkinson's disease to be the world's fastest growing brain disease. We'll continue to allow Americans to spend 1/5 of their life with a debilitating disease that robs them of their independence. We must stop the status quo. We must change course. We must act to prevent Parkinson's disease. This book was done with great colleagues. Todd Scher, who used to be the CEO of the Michael J. Fox Foundation and still oversees a lot of the research efforts. Dr. Michael Okins, a pioneer in deep brain stimulation and is the chair of neurology at the University of Florida. And Dr. Bas Bloom is the creator of the world's largest care program for Parkinson's disease called ParkinsonNet. You can buy the book on Amazon or any bookstores. All the authors are donating their proceeds from the book to efforts to end Parkinson's disease. If you can't afford the book, we will mail you one for free. If you can't afford the book, I'll mail it to you for free. Just email me at info@endingpd.org. And if you get fired up by this talk and want to help change the course, join a global grassroots organization formed by people with Parkinson's disease in 30 different countries. It's called the PD Avengers. Go to pdavengers.com and make your voices heard. We've done this before. We've done this with polio in the 1930s and 40s. We've done it with HIV in the 1980s. Mothers Against Drunk Driving did it in the 1980s. They didn't argue for better emergency rooms and trauma services and better ambulances. They argued for us to stop drinking and driving, because they thought if you stop drinking and driving, you can stop tragedies that are happening to families around the world. If you do the same for Parkinson's disease, we can prevent Parkinson's disease in this country and around the world. That's our challenge, and that's our goal. We hope that you'll join us. Thanks very much.